Welcome to Nerdy Psychology. Break it down with a little curiosity. Go be curious, stay kind, keep your mind nerdy.
I want to start with a claim that sounds a little like clickbait, but is actually a peer-reviewed finding published in an APA journal. The largest mental health provider in the United States right now might not be a hospital system. It might not even be your insurance network's provider list. Honestly, it might not even be a human. It might be ChatGPT. A study published this year in an APA journal, Practice Innovations, found that nearly half of people who used AI chatbots and have mental health condition are using that chatbot for their mental health condition, not as a joke, not as a novelty, but as actual support. So today we're putting on our nerdy hats and asking the question every therapist, every client, and frankly, every person with a smartphone should be asking. Is this actually helping people? And what does it mean for the future of how we get support? Let's get into it. Let's get the receipts straight first, because this is the kind of finding that can get distorted really quickly on social media. Researchers surveyed nearly 500 US adults who had an ongoing mental health condition and had previously used large language models like ChatGPT or Claude or Gemini. This wasn't a random poll of general population. It was specifically people already in both categories. Keep that in mind. We're going to come back to that. But here's what they found. They found that 48.7% of people who use AI and have a mental health condition are using these chatbots specifically for therapeutic style support. And when you ask, well, what that breakdown looks like this. 73% said for anxiety management. 63% said for just general personal advice. 60% said for depression support. 58% said for emotional insight. 56% said for mood improvement. 35% said specifically to feel less lonely. That last one stopped me. People are literally opening up an AI chatbot at 2 a.m. when no one else is awake, specifically to combat loneliness. We'll sit with that for a moment later. Now, here's the number I think should be the real headline. 63% of users said using a large language model improved their mental health. Not it was fine or it was okay, but improved. Okay, nerdy psychology brain, let's dig in, because people feeling better isn't enough. I want to know, what are the mechanisms? So 2 words came up constantly in this research: accessibility and affordability. 90% of respondents cited accessibility as a primary reason they turned to AI. 70% cited affordability. And honestly, that tracks with everything we know about the barriers to traditional mental health care. The average wait time for a new therapy client in the US can stretch weeks, sometimes months. Many insurance networks have provider shortages, and sliding scale spots, they can fill up quickly. Therapy, when you can find it, can cost a lot, but a large language model has none of those barriers. It's available at 3 a.m. during that panic attack. It doesn't have a wait list. It doesn't require a copay. But here's the part that I genuinely think is fascinating, well, from a clinical perspective. It's not just about access. People are reporting something deeper. 39% of respondents rated large language models as equally helpful as human therapy. 36% said that large language models were more helpful than the human therapists that they had previously worked with. And combined, that's nearly 3/4 of people rating their AI experience as on par or better than human therapy. Now, before you think I'm about to recommend firing your therapist, let's talk about why this might be happening. Because the mechanism is way more nuanced than, well, AI is just better. One survey respondent who described themselves as introverted said something that I really found clarifying. They explained that, well, with a human therapist, their social anxiety would activate that same fight or flight performance pressure that could show up when we're public speaking. And then talking to an AI, it bypassed that activation entirely. Another respondent who has autism described using the chatbot to process social situations that they found difficult to read in real time. This points to something researchers call the disinhibition effect. It's well documented in psychology, going back to the early internet communications research. When the social stakes of being perceived, judged, or watched are removed, some people access emotional material more easily. It's part of why anonymous support groups and journal writing have therapeutic value to them. The chatbot isn't more emotionally skilled than a therapist. It's just structurally incapable of, well, making someone feel embarrassed for their moment of disclosure. For some nervous systems, that absence of social threat in itself is therapeutic. But this is where I think the psychology becomes really fascinating. Okay, let's imagine you're having a difficult day and you reach out to your AI companion. It responds immediately. It doesn't judge you. It doesn't criticize you. It's not distracted. It's not telling you, I'm too busy. It's available 24 hours a day. Now think about that for a moment. Many of the things that people appreciate about AI companions aren't actually the technology features. They're relationship features. Availability, attention, validation, consistency, being heard. Those are deeply human needs. And I think that's one reason people are turning to AI for support. Now, I'm a clinician, and I would be doing you a disservice if I made this sound like this unambiguous win. So let's talk about the data and things that should make us pause in this. 34 respondents described feeling, well, ambivalent about how helpful their experience actually was. And that's not a small number. That's roughly 1 in 3 people who weren't sure if it was helping. And then there's the part that matters most. 9% of users reported receiving harmful or inappropriate responses from large language models during a mental health conversation. And of those incidences, some were factually incorrect, some were dismissive or minimizing of what the person was trying to communicate, some were offensive or really insensitive. And some said the chatbot's response actively encouraged harmful behavior. One respondent described asking detailed questions during a panic attack and received information that literally made their nervous system feel worse, not better. And here's the clinical concern. In plain terms, a trained human therapist, well, they're taught to recognize escalation. They know when a client's question is itself a symptom. When you tell me about the side effects of this medication during a depressive episode, isn't really a factual question. It's a crisis signal. And large language models, as sophisticated as they are, don't reliably make that distinction the way that trained clinicians do. They can respond to the literal question instead of the underlying clinical picture. And this is exactly why the researchers behind this study were careful to frame their conclusions in a specific way. Large language models may be a complement to human therapy, but not a replacement. I also want to flag something about the sample itself. The study specifically recruited people who, well, already use large language models for this purpose. So naturally, the respondents had more positive associations with it. That doesn't make the findings meaningless, but it does mean that we should read 63% improved with the appropriate grain of salt that the researchers themselves acknowledged. So if you or someone you love is one of the people who are already doing this, how do we do this in a way that can be more helpful? Here are 3 guidelines. Use AI as a bridge, not a destination. The research suggests that large language models work best as what researchers call kind of the gateway, a low barrier entry point that can lead to someone to go seek deeper support. It's not the final stop. If you're using AI chatbots for emotional support, periodically ask yourself, is this supplementing my support system, or has it quietly become my support system? If it's the latter, that's useful information, not failure. It's a signal that it's time to add some human layers, whether it's a friend or a support group or professional help. 2, treat AI mental health advice like WebMD, not like a diagnosis. This is true of any self-guided health information. It's most useful as a starting point for understanding an experience, not as the final clinical answer. Large language models can be excellent for things like psychoeducation. And a real respondent described using their large language model to help them with DBT skills or understand the physiology of a panic attack. So for using AI tools, learn frameworks and coping skills generally. But for anything involving medication or diagnosis or crisis level symptoms, treat the AI's response as a prompt to go seek professional help and know the crisis line numbers regardless. Given that the research shows real risk of harmful responses during acute moments, it's worth having human crisis resources memorized or saved before you need them, not searched for in the moment. So save 988, the suicide and crisis lifeline, in your phone right now, even if you never expect to need it. If you're already using AI tools for emotional regulation, this is the single highest value 5 seconds you could spend today. Now it's time for my favorite part of the episode, the nerdy research meter. Remember, this is not about deciding whether a study is good or bad. It's about asking one simple question: how confident should we be in applying these findings today? So we have a rating scale. 1, strong evidence. This finding is supported by a large and consistent body of high quality research, so we could have higher level of confidence in applying it. The second rating is promising evidence, and this is research that is encouraging and generally consistent, but important questions remain, so our confidence is growing rather than complete. The third rating is early evidence, and these findings are interesting and promising, but they're still early, meaning more research is needed before drawing strong conclusions. And the fourth part of the rating is preliminary, and this is that evidence is currently limited or mixed, so it's too soon to make any confident recommendations, even though the idea may eventually prove true. So for today's study, I am going to give this a good, promising evidence rating. Why? Because it was published in a peer-reviewed journal and surveyed nearly 500 adults who were already using AI for mental health support. And it gives us valuable insight into how people are actually using these tools. But because the study relied on self-report from people who already chose to use AI, it can't tell us whether AI caused those improvements or whether the findings apply to everyone. In other words, this is encouraging evidence, but it's not the final word. And that is exactly why we use the Nerdy Research Meter. It's not a report card for the researchers. It's a way of asking, how confident should we be in applying these findings based on the evidence we have today? This episode is sponsored by my workbook, Your Next Chapter. If this episode has you thinking about how you process stress and where you turn to for support, this workbook offers structured, clinician-developed ways to build that self-awareness with practical tools for emotional wellness, coping, navigating life's harder chapters. It's designed by me as a clinician to be something you could actually use, not just read, and the link is in the description below. If this episode gave you something to think about, I invite you to subscribe and tell me in the comments, have you ever used an AI chatbot for emotional support? No judgment. The data says you're not alone. And if you're interested in reading this article yourself, it's linked in the description below. We may be witnessing something genuinely unprecedented, a mental health support system that nobody designed, that just emerged almost by accident, being used by people in the privacy of their homes. So before we close, I want to make an important note. This video discusses one survey and an emerging area of research regarding AI companions and emotional support. The research in this area is still developing, and we do not yet fully understand the long-term benefits, limitations, or risks. My goal in this video is not to recommend AI companions for mental health therapy or mental health treatment, or even to replace meaningful human connections. Rather, I think this topic raises interesting questions about loneliness, connection, and the human need to feel understood. It's also important to recognize that AI systems can provide inaccurate information, reinforce unhealthy patterns, miss important safety concerns, and lack the judgment and accountability and clinical training of licensed mental health professionals. Seeking support from qualified professionals and trusted people in your life remains highly important. It's not inherently good or bad, it's just true. And the more psychologically healthy thing we can do right now is to get curious about AI rather than just dismiss it or treat it like it's a replacement. If this conversation resonated with you, I think you will really enjoy my episode on the loneliness epidemic because it connects directly to what we talked about today. The fact that 35% of people using AI for mental health support are doing it specifically to feel less alone tells us something more important about how isolated many of us are. And that episode goes deep on the why. Until next time, be curious, stay kind, and keep your mind nerdy. That's a wrap. See you next week.
Be curious, stay kind, keep your mind nerdy.